Well, I think America still has some. I wouldn't say there's universal agreement about what should happen about health care in the United States. But I do think the whole Affordable Care Act, which actually has been going, these conversations have been going on forever, depending on the presidential leadership and so forth. I think people now realize that there's thoughts of cutting back, and they can see the difference it made, that they like it better than they thought they did. I mean, when Medicare first came out, it was like, first people were happy because more people would get care, because older people didn't have health insurance, and so people just died earlier, and I mean, it was dramatic, and people would, I can still remember my grandparents talking about, my grandfather saying, well, I don't want to spend the money on that, so I don't doctor much. That was sort of how you talked about if you're, and I in some ways I kind of agree with not doctoring too much. You can overdo that as well. But anyway, so there were a lot of bumps in the road as Medicare got started, figuring out how the billing was, yada, 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 and people argued about it. On the other hand, 20 years later, they love it and think they couldn't live without it, which doesn't mean it still doesn't have some bumps in the road. But I think the government and the U.S. population learned a lot about what that meant, and people live older and all that sort of thing. So as the Affordable Care Act went into action, clearly it worked better in some states than others, and those that fully adopted it, people got better care for less of a price, and the government paid for it. Of course, I think the flip side of that is if you're a conservative Republican, you would say, well, any way we can save money is what we should do across the board, whatever. But I still think, I always wonder when I read that, do you have anybody in your family who's really been ill, or who really needed high levels of care, or what's your exposure to it? Because I think most of us have had, if you're in a family, or if you, I mean, we all know people that really need a lot of care for whatever reason.